Welcome to Sharing My Truth with Mel and Susie, the uncensored version, where we bear it all.
We do. Hello, everyone, and welcome back to Sharing My Truth Pod. You're here with Mel and Susie, and we just had a really, really important and powerful interview with this gorgeous and lovely girl. Her name is Brittany Cristantos, and I hope I'm saying that right. So we just finished the interview. It's on a really important topic that I think a lot of our audience will take something really positive away from. And she speaks a lot about mental health, and she is a best-selling author. She's a speaker. She's a mental health advocate. You can hear her own podcast at Dear Brittany Podcast, which is really cool. Her Instagram is Brit Cristantos. She spells it for you on the pod. And yeah, if you're struggling with mental health, like I think a lot of us are in this mental health crisis, she's a really important person to kind of get in touch with. Hey, babes.
Hello, darling.
How are you?
I'm fine. I'm all good.
Yeah.
So we've done this interview. Obviously, mental health is, I think, something that's very misunderstood.
Mm-hmm.
And we too talk about it a lot more today than we did, 20, 30 years ago when I was young, which is great. I mean, obviously, that's very positive. And we live in Canada, and Brittany is in Canada too.
Mm-hmm.
And Canada really is a place where this is a very progressive country.
Mm-hmm.
And this is somewhere where you can get help.
Mm-hmm.
Obviously, universal healthcare, but you can get help. You can speak to people. There are resources. They may not be perfect before anybody tells me off for that, but it really is, we're very lucky because that doesn't exist in a lot of other countries.
Yeah.
But she's an advocate. That is very important for people to talk about it, to talk about when they were in a dark place, how they went from the dark place to the light place, as it were. And for particularly anybody struggling, and probably in her case, because she's Gen Z, anybody who's young who's struggling. And there really is an epidemic of that. I mean, I have two, as we know, I've said many times, two teenagers. Thankfully, that's not something I've had to deal with my children, but with many of their friends, I've seen, so many issues: anxiety, depression, ADHD, panic attacks, all sorts of, very serious stuff. Obviously, very tragically, suicides, particularly in the pandemic, that was really all too prevalent. It was really horrible. Both my kids, I think they knew about 5 kids.
Wow.
That committed suicide. And that, there are no words for how horrendous that is. And I think, obviously, you need to find somebody if you are struggling. And that is the one probably good thing about social media, is that you can find somebody who you can identify with, who you can inspire you, who maybe was in a tricky place, in a dark place, and managed to overcome their struggles and get help. And that actually could be very helpful, and she's obviously doing this and, is Gen Z, she's 25, so could obviously speak to younger people about that. And I know she does a lot of work about that, and she, does speaking events and so on. And it is obviously very important because we're still not very clear as to what it is, mental health.
Yeah.
I think we bandy the word around and we talk about it incessantly.
Yeah.
And, I spoke to Brittany from my own point of view as somebody who, my mother is mentally ill, has a mental illness. She's bipolar, and I've lived my whole life with that. And it's very, very difficult for the family members. It's incredibly hard. And there is an enormous difference between that, which is sometimes not survivable, sometimes not very manageable in my mother's case, and mental health. And this idea of what does mental health actually mean? And there are levels of it. There's mental health that is, you are struggling. And as we all know, different people in our lives who, like, let's say I'll deal with stress and in one way, and they'll deal with it. They'll just get very stressed out about something that just, to me, will be nothing. Like, for example, if I use you as an example, Susie, you're somebody who's very, very good at staying cool, calm, collected in stressful situations. You seem to have a real ability to just not let it affect you, which is amazing.
Yeah, I don't know how I do it, to be honest. I don't know why.
I mean,
or
I
how.
saw you once. You'd lost your phone, and I was like, "Holy shit! If I'd lost my phone, I'd been going nuts." You were like, "Yeah, it's okay. I was in an Uber," and you just very calmly. And the guy came back, and the phone was in the car. It had fallen out of a bag or whatever.
Yeah.
But you were like, "It's okay." You had it completely in your mind under control. Whereas the next person, the same thing could have happened, and they'd be going fucking apeshit. They'd be thinking, "Oh my god, and my passwords, and my credit card, and my security," like everything would be going in your head, going.
Yeah.
And so for one person, what something is like, what's the big deal? Another person is a huge thing.
Yeah.
The same with depression. Like, one person is depressed about or gets the blues or gets low very easily, and another person doesn't. So we all have a predisposition, or gets anxious or nervous, and we all have a predisposition for something. But that's the state of being human.
Yeah.
And I don't think we talk about that enough. And then and to understand that I'm afraid is being human. You are going to have moments in your life which are unbelievably stressful. And you're going to have moments in your life where fucking everything is going to happen at the same time. Something awful is going to happen in your family. You're going to have a financial problem. The shit is going to rain down. And you just think, how the hell do I get through this? And you do. And that is unfortunately part of life. And obviously some people are able to cope through those situations and others aren't. But even just this idea that you have days where you're blue, you're depressed, or you're low, and particularly women can be very affected because of hormonal changes. And to understand that is life,
Yeah, I totally agree. Like it's a very hard, if you don't have a mental health issue in the way of like something that's like, diagnosed by like a psychologist or something, then you don't really fully understand the depth of what can happen with some people, like obviously Brittany speaks about. And I'm totally with you, Mel. Like there is a huge mental health crisis, but there's also a huge mental illness crisis, and
100%.
we should not be the two can't really be compared, and they shouldn't be like not connected, but like intertwined in the way of like, this is not the same thing.
It's not the same thing.
It's not the same thing.
You having a bad day.
Yeah.
And, being somebody who has serious panic attacks or has serious mental illness issues, they're bipolar or they're schizophrenic or whatever it is not the same thing. It's not even the same conversation.
Yeah.
And even I would say there are sort of 3 levels. There's mental illness, which may not be curable. It's something you manage.
Yes.
And probably isn't curable. Then there's mental health. Like you are somebody who suffers from panic attacks or anxiety, extreme feelings of something or another.
Yeah.
And you need some empathy from people. You need some help to come to grips with some tools to be able to deal with those challenges. And then the third thing is this idea that we all have to manage our mind. We all have dark thoughts, some obviously a lot darker than others. We all have depressive thoughts. We have all kinds of thoughts that go through our head different every day that we have to manage, and stress levels too. Like sometimes like life is it's just like, oh my god, it's just too much.
Yeah.
But I'm afraid what are you going to do? Not deal with it?
Yeah.
And so I think my generation, the sort of Gen X generation, where there was nobody who ever said, oh yeah, just take a mental health day. I mean, I think if you had said that while I was working in my 20s, they would be like, oh, what now? They would have fired you. I mean, I would have got fired. I think I once took a day off because my hangover was so bad that I just couldn't. But if you'd actually called up and said, you'd actually be worried, saying if some awful tragedy have happened in your family.
Yeah.
That would have been difficult to say, look, I need to go to the funeral. I need to go and do this. Okay, in that case, maybe okay. But it was very difficult to to say I'm suffering or anything, absolutely no way would anybody have listened to you. And that isn't good. And there was no empathy. I remember when I was young and I started out sort of working in the private sector, working in sales, and it was always like, don't mix, emotions with business, don't mix, personal with business. This, and people would say to you all the time, this is business. And then, I run my own businesses, and my view is completely different. I'm like, I'm sorry, but people make up businesses. Businesses are run by people. So you have to understand people. You have to be empathetic. We're not robots. And, like that sort of 80s Wall Street, Gordon Gekko kind of, eat people alive. You don't stop. You keep going. Do you know what I mean by that movie?
Yeah,
and that
Wall
obviously,
Street, yeah.
obviously that's changed a huge amount. We've evolved a huge amount. It's really important, but there's also a level that people have to. Some people are taking the piss, quite frankly, and they call up and say, I'm having a mental health day just because they can't be asked to get out of bed.
There's people who take advantage of it like 100%. And that's the problem with, obviously, one of the problems with this mental health crisis is that it's not a physical problem, right? Like even like schizophrenia or like being bipolar, like some of these traits are more obvious than others, right? So
100%.
It's like when you have like a mental health problem, like you're stressed or you're like depressed, it's like people can't see it really sometimes.
100%.
And so that's like
true.
And so people find it super hard to understand because they're like, well, everything's okay with you, it looks like everything's fine, so are you really like, is something really going on? And like obviously like that's a huge part of the problem because we have to like rely on our empathy. And you can't rely on empathy when you're dealing with other people, right? Like it's like, how can you, if I'm telling you I'm having a bad day, you'll believe me because you know me.
Yeah.
But if I'm telling my boss I'm having a bad day, he's going to be suspicious. He's going to be like, you were fine yesterday, so
Well,
what's the
100%.
problem?
And I agree with that, but I agree with that, but there is still this huge difference between I'm finding it difficult to cope. I'm actually in a position where I'm taking some kind of I'm having some kind of therapy. I'm taking some kind of drug for managing anxiety or whatever, which is a whole different level. And then there's another level, which is actual illness. And what I mean by illness, and I think if people haven't lived this, have not seen it, they don't understand. Like, I deal, and again, I'm bringing this back to myself. I'm trying not to be selfish in this conversation. I'm just trying to relate this to other people in a way that Brittany, like, I do feel that it's important to talk about it, to sort of be a bit of an advocate. My mother, one of the things I've recently dealt with is that is her being sectioned by the government. So that is, my mum lives in the UK, and in the UK, we obviously also have universal healthcare. And whatever anybody says about the NHS, it is incredible in dealing with these things. It's a huge organization. It's able to, with her, it's been able to pretty much save her life.
Right.
And, but there's a point where you get so bad that the state can intervene and section you and put you in an institution. And my mum is steps away from that. And I've recently had to deal with that. And, the police get involved and the government, and it's horrible. It's horrible. And people who haven't seen what that is a million bajillion miles away from going, oh, I'm having a bad day.
Yeah.
And I think by the conversation about mental health, which is very important.
Yes.
And I've actually, even my own personal ways, have done some advocacy and spoken to friends of mine who've have issues with their children who are suffering from mental health issues, or in some cases mental illness. And they've agreed with me that we need to have more conversation about how serious this is, but that it's not all the same thing.
No.
And that we've, in a way, it's not the fact that we've talked about it so much. It's the fact that we don't talk about the differences.
Totally.
That we've trivialized a part of mental health to the point that somebody who just thinks, opens the window, it's raining today, can't be asked, goes back to bed. And they call that a mental health day.
Yeah.
And, people can come and say, "Oh, you fucking Gen X, so you've got that attitude." But I mean, it's true.
Yeah, well, there's also the other thing where it's like we're looking at a lot of these things as weaknesses when a lot of these things, like a lot of our differences, and especially like when you get through a dark period in your life, it actually makes you stronger as a person.
100%.
And so it's like I think a lot of us who have like lived a bit of life, and obviously like I haven't lived as much life as you, Brittany hasn't
Yeah.
lived as much life as me. Like there's just like there's things that we've gone through that make us a better person in society, or just like, you know, more understanding, and just, you know, these differences and these problems actually make us stronger in the way of like, you know how to get through these things instead of just stay dark.
100%. I sort of add something to also what I said before. And what I mean is that people who are looking out the window going, "Oh, I can't be bothered to go to work," and saying they want a mental health day, they are not helping the people, millions and millions of people who really need some fucking help
Yeah.
and don't know where to go. Even in countries like Canada and Britain, where it's or France or Western Europe, where it's much easier to get to that because it's provided by the state. They are alone and they're frightened, and they're frightened of themselves. They're frightened of their thoughts. And it's very difficult to reach out to people. And I think another thing, if I think of my life where I've had some real instances of real darkness, and while you're going through the darkness, people like, "Oh, can you help?" And you're like, "Well, what are you going to do? How are you going to resolve the situation which is caused by, some tragedy that's happened to me? How are you going to help me?" And I think that's another thing we don't understand, and that when you get through it, I've certainly found, then you can talk about it. But when you're in it, it's very, very difficult. You are literally like knee deep or up to your neck in mud.
Yeah.
And you can't talk to anyone because how's it going to help? It's not going to stop anything. But I'm empathizing with people. That's what I'm trying to. I've lived that. I understand that. But what we need to try and have a conversation is that while you are neck deep in the mud, is where do you go for help? Who can you reach out to? How can you get some support from somebody who is not going to judge you? Because the problem is, if you talk to your family generally or your friend,
Yeah.
they will judge you. They can be the nicest people in the world.
Yeah.
But we all have preconceived ideas about a person. And especially if we know them, we've kind of put them in a little box and we're going to make a judgment.
Totally.
And you need to go and talk to somebody. And I've told many people when I have at various points in my life sought help, and it was incredibly beneficial. It didn't help me resolve the problem, but it helped me see through the problem. It helped me step back and go, "Okay, I can do this.
Yeah.
I can get through this. I can
Yes.
get through this minefield of absolute shit." And that's what the help was there for, was to go to somebody who didn't judge me, who didn't have any idea of really who I was, just saw the thing I was telling them, right? But again, I would like to say, and Brittany mentioned this in the interview, even in a country like Canada, that you have to often go and pay for that. And it is hugely costly. It's so expensive. And, it's just a never ending thing. And so from that point of view, that's what I say for those millions, thousands of people who are suffering, who don't know, what do I do? How do I stop this? How do I move on? It's incredibly difficult. But if you can find, at the very least, some kind of inspiring people to say, okay, they have seen darkness and they've been able to come through it. And maybe, and I'm not entirely sure how many resources, but there are resources, out there, and maybe Brittany has some on her page.
Yeah, well, there's a number that if you do
Yeah,
live in
she
Canada,
mentioned,
you can call 988. I believe that's what she
Yeah.
says, 988. And you can talk to someone. There's also the kids' help phone if you're underage, or for the
Right.
youth. But yeah, I think there are resources. I don't think they're hard to find, but I think they're, when we talk about this on the interview, it's just like they're hard to, if you're trying to go in person, it's hard to get a hold of. It's expensive, and there's also
Right.
wait lists. So trying to find a friend you trust who you don't think will judge you, trying to find a teacher or a mentor
Yeah.
or something like that who you
Yeah.
know, it's not going to, be like in quotes, like not a big deal to them. Like, just like them wanting to help you, them wanting to be with you, that like for that,
100%,
for you, for that. So trying to find that person in your life. It's just one person. Like that's all you need.
100%. Even a relative who perhaps is not like a mother or father, that you have a kind of an easier relationship, that you can say things. Because I think like you're talking about the phone number. That's part of the problem. People can't even pick up the phone, even though pushing the buttons.
Exactly.
To get the words out of your mouth, to get from your brain to your mouth, to express what's going on, is an enormous challenge. Because the other thing that I don't think people understand, that if you say it, it's real. And if you don't say it and you keep it in your head and it goes round and round and round and round, somehow maybe it's not as real, it's not as bad.
Yeah.
It's a bit like anything in life. You have relationship troubles, money troubles, whatever. If you don't say it, somehow it's not real. The minute you say it and you discuss it, you're like, shit, I've got to deal with it.
Yeah.
And it's real, and that's incredibly difficult. But I think both you and I are saying we come from a place of real empathy, real understanding. I personally believe the conversation is very important. I just wish we'd shift the narrative a bit and be a little bit more kind of inclusive, would explain a little bit like, what does this mean, mental health, and talk about the different levels. And I think that would help people. And also, like I said, I see a lot of young kids, a lot of teenagers, and there's an enormous amount of teenagers struggling and taking all kinds of medications, which scares the shit out of me, quite frankly. I find it really terrifying, the amount of teenagers and sort of tweens taking medication for, anxiety, ADHD, depression, stress, blah, blah, blah.
And even like not just those medications, but also like weed and stuff like that, like way too
100%,
early. Like it's just like, it's just the fact that of you being just what is it, like you're like whole, what is it? What am I trying to say, Mel?
You mean before your brain like fully forms?
Exactly.
Yeah.
Like you're what am I trying to say? There's a word.
Yeah, there is a word, but I can't think what the word is.
Whatever.
But I know what you mean.
But yeah, so like
you all know what we mean.
You all know what we fucking mean. So like, yeah, you're just like, you're holding on to this thing to kind of, make you fall asleep. Like
dampen your feelings.
Yes, exactly. Yeah. Like it's like, well, no, you need to know how to regulate your own emotions. That's also what I'm trying to say. It's like regulate your own emotions. Trying to fall asleep on your own. Like if you are taking all these pills, if you're doing all these, even if they're like in quotes natural medication, it's not like you still have to let your brain develop and like
I agree.
Try to find your own way through things. And yeah, medication is scary. Like that's why I don't even take birth control. We've already talked about that.
Yeah. it's terrifying. It's absolutely terrifying at such a young age. But on the other hand, you see parents and they just don't know what do you do? You just don't know what to do.
Yeah.
And I think because
especially when it's so available.
It's so available. I think there's so much talk. There's obviously the element of social media of, what do they call it? Suicidal iteration or the ideation? What's the word? Is like thoughts of it. And we talk about it. And I think a lot of parents are absolutely terrified. Oh my God, like you just don't know where this is going or what information that you can find. And that is something that obviously in my generation, you weren't finding. You couldn't go online and find some crazy website about something completely nuts. Right. And, the whatever you're feeling, whatever you're going through in a positive way, you can find a community online. The big problem is that whatever you're going through, you can find a negative community online. You can find any number of just complete and utter assholes who want to scam you. And, so that's the problem.
Yeah.
And be very, very, very careful of that.
All right. Should we start the pod then?
Yeah.
Should we listen to the goddamn interview? Well, thank you so much again for Brittany to come on to our pod and talk about it. I know it's not easy to talk about her own mental health struggles and issues. And so, yeah, we hope you enjoy the interview. We'd also love for you guys to, if you guys have an opinion or you have your own story, you want to share that with us at Share My Truth Pod. On the socials, or go to sharemytruth.com and you can send us a little email or voicemail there.
Yeah.
Love
you
yous.
Next time.
Hello, Brittany. Thank you so much for joining us at Share My Truth Pod. I know our listeners are very excited to hear what you have to say. And we're just so happy that you spent the time to come on our pod today. Thank you.
Thank you so much for having me. I'm so excited to speak our truths today.
I love that. I just want to start the podcast just with you, just giving our audience just a brief rundown of who you are, and where they can find more information on you.
Yeah, I'm Brittany, and a little bit about me is, I'm a mental health advocate, but I like to really break it down to why I'm a mental health advocate and who I am as a person so I can share, a significant moment in my life that made me who I am. I struggled as a teenager with depression and anxiety as at 15 years old, and all the struggles that I've gone through as a teenager led me to where I am today. I wrote a book when I was 15 years old called I'm Not Your Average Teen, and fast forward to over 10 years later, I am advocating and trying to fight for mental health because so many lives are being affected by mental health. And, you know, our generation today is going through so many struggles. So I believe mental health is something that's so important to me. And I'm really excited, to talk more about that and talk about, more about my journey. But really, it all started with me going through my struggles and overcoming those.
It's so empowering. I think I was actually just talking about it with another friend of mine today, and it is really crazy to think about. Everyone is having mental health issues, and I mean, I don't want to say, oh, this is a new thing. Oh, this is just coming about. Maybe it's just we're actually bringing awareness to it now. Um, but why do you think it is that everyone, in quotations, like is having mental health problems or challenges these days? Is it social media? Like, what is it?
I think for one, we've all gone through so much. Like we can't deny the fact that we went through a pandemic. We, went through what, like 4 years of staying inside or 3 years of a struggle that we all went through. But really, we all go through mental health. And, there's a stat that says 1 in 4 people have a mental health struggle. That is a lot of people. Like if you add two more people to your room right now, one of you is going to go through something very severe. And so, this mental health crisis is really doubling. But I think the problem, to answer your question, is that no one got the help that they needed. Like, mental health was something that we never spoke about when I was little, or when I was a teenager. Only recently we're talking about it. But I believe that's really a big reason why people are struggling is because we never got the awareness or the education or even the resources to talk about mental health back in the day. And so now we're all facing struggles, big or small. We're all going through something.
Hmm. And what is the thing? Can I ask you? Are you Gen Z?
Yes.
You're in your sort of mid-20s.
Mhm.
Yeah. So what is the thing that helped you navigate obviously a big struggle? Like what's brought you to the place you are today? What's the thing
Well,
that
for one, for me, I was in a place where I was in so much darkness and so much anxiety, and I was in a place where I didn't want to live anymore, to be totally truthful with you. I was 15 years old, and I was having these suicidal thoughts, like,
Mhm.
even almost attempted my life, and, in that moment, I didn't see any light, I didn't see any joy, but then for me, it was that moment of darkness where I realized, I need to live for something and I needed to change my life around. And I became obsessed with the idea of changing my life around. So I started to read self help books. I went to the bookstore with my grandfather and bought like whole stacks of books and started becoming obsessed with the idea of like happiness. But for so many others, we can't rely on the fact of, oh, maybe they will find hope or maybe they will, think last minute, oh, I don't want to do this because we can't obviously think like that because not everyone's gonna have a glimpse of hope or see the light like I did. So for me, it was more like in those dark moments or dark thoughts, I was thinking, I can't do this. I have so much more to look forward to. But getting the help, asking the help was something that was really big. I reached out to a local therapist and then a local life coach, and then I
Mhm.
did all these things at 15 on my own without my parents even knowing.
Oh,
But
wow.
that's
Okay.
not normal. That's not
No.
okay. Like, you should go to your parents. You should speak up and talk about the mental health struggles you're going through. Like, you shouldn't have to go through it alone. And so, yeah, I got help and, yeah, I'm here today and doing things, but it wasn't the normal way of doing it, and if I were
Mhm.
to go back, I would have said, "No, I should have gone to talk to my parents and said, 'Hey, I'm having these thoughts, taking me to a therapist or let's get help.'"
Was it shame stopping you from going to your parent? What was stopping? Is, if you don't mind me asking, was it the lack of openness with your parents, or was it something in you that you were just like, I don't want to admit this. If I go to them, then I'm admitting there's an issue.
Yeah, it was more shame because at the
Mhm.
time, over 10 years ago when I was 15, there was no awareness. There was no, "Hey, mental health is okay to talk about it." So for sure I was, nervous about talking about it to my parents because I was worried they were gonna judge me.
Mhm.
Worried that if people found out, they would start like calling me names, "Oh, she's weird," or "She's
Yeah.
this." So definitely with shame, but I believe 10 years later we are evolving and there is no shame in that.
Mhm. 100%. Yeah, I
Yeah.
mean, it's certainly come on a very long way, and certainly from when I was 15, a million years ago, there was nothing, there was no discussion. I mean, there was no even it didn't even enter anybody's thought process that this is serious. Everyone has to figure out how to manage their mind, and it's very difficult.
Mhm.
It's
Very
an
difficult.
extremely difficult thing to do. Yeah.
So how are you still like I know you said you read all these incredible books that really changed your life. Was there one book that you and then obviously you wrote a book, but was there one book that you read or two or three books that like really kind of turned it around for you?
Yeah, there's this one book called How to Heal Your Life by Louise Hay. She talked about how you can change your life by doing certain things like positive thinking and energy and the thoughts that you think can become certain things in your life. And so I loved reading that book because it was like this big idea for me is like, how can I change my life, being that I'm still in high school at the time and uh, and dealing with high school problems obviously. And that book was really motivating for me to realize that, hey, I can change my life. And it's about little steps and little actions in your life that can really change it for you.
Like manifesting
Yeah.
positive energy,
Positive.
positive thoughts. Yeah.
Yes.
Yeah. I think there's a lot of truth to that.
Yeah, I find it so hard. Like, I mean, I'm definitely not in the high school. I freaking wish. But I do find my day to day, like obviously like working now, in like just my everyday company, like, you have to find the reason why you're doing everything day to day. And it's like you start getting into these negative thoughts. And I think a lot of people start just getting into these negative thoughts because they're around negative people, or not even that, but they're just like they're dealing with stuff that they don't know how to, and they're afraid, and there's like all these things going on, and they feel like they're losing control a bit. And I feel like I have that feeling a lot because I have the tendency to put too much on my plate
Mm.
and I don't know how to take stuff off because I don't know how to say no, and that's another problem. But I yeah, there's these things, and I'll catch myself having these horrible negative thoughts about like myself or just about like my situation. And I'm like, I literally have to go back and think about like, oh my God, Susie, you should be so not should be, but like I am so grateful. Like I can't believe this is my life. Like this if I was looking at my life 10 years ago now, I would be like, oh, holy shit, like you are amazing, right? Like, and I'm sure that's what you think about yourself. Do you catch yourself going back into that area of like darkness, and like what do you do to kind of get yourself out of that?
Um, so I so obviously I'm human. I'm 26 years old. I'm going to struggle. I'm going to go through darkness. We all do. We go through heartbreak. We go through stress in my career. I of course I we all struggle, but would I call it darkness? No, because I know I am so grateful for the life I have and for the things I get to do and the people I get to meet and the life I created for myself. So I don't go into darkness.
Mm.
But yes, of course, I'm human. I'm a woman. I get my period sometimes, and I'm a bitch. And sorry for swearing on your.
No,
No,
please
please.
get it out. Get it out.
I have moments of,
Mm.
moments of bad days, good days, like any human out there, any Gen Z, any young adult out there is gonna have a moment of a low moment, but I wouldn't call it darkness. I would just call it being human for one.
Mhm.
Yeah. So I have a question for you. That what do you think? Like we live in Canada, you're in Canada. A lot of our audience is actually in the US and other places like the UK and also Canada. But you're in Canada, we're in Canada. And I would say Canada is a very, very progressive country and compared to other countries, takes mental health very seriously. And certainly has evolved a huge amount, and a lot of other countries do not take it seriously. But
Mhm.
what I know that you live this personally and also professionally, and I know you've done a lot of speaking and so on, with some very influential people. So what do you think about the state of where we are in this conversation about mental health in this country? What do you think about that? What are your thoughts?
I think for one, what you said there is powerful. I'm grateful to live in a country. I really am to live in a country where they really take mental health seriously. There's other countries out there, like you said, that don't, or they don't do what our country does. I mean, Canada, we're a country that's evolving, and as Canadians, our superpower, I believe, is stepping up and helping people.
Hmm.
And so, Canada has departments for mental health now, both provincial and government, federal. I believe they're really taking mental health really seriously. But of course, as any country or anything, we can do better. But
Hmm.
I'm really grateful to be in a country where mental health is something that is accessible and is reachable. And for Canadians who are struggling, I mean, there is help. There's now a hotline that we didn't have back then. It's called 988. And
Hmm.
any Canadian going through mental health struggles can just call that help hotline, and there's help available. And I know other countries don't have that, so I feel horrible for other people out there who don't have help that I wish they did. But I think I'm really grateful to be living in a country that takes mental health seriously. Of course, like anything, there is times where we need to evolve and do better, or create more opportunities and more resources. But for the first start, I think it's really great, and they're doing really great stuff.
Okay.
Yeah, I mean, it's so interesting. Like, I feel like, uh, and I want to go back to something you said at the very beginning, of just like, like we didn't have all these like in quotations, like we didn't have these mental health struggles like earlier. Obviously,
Yeah.
like in previous years, obviously we've always had mental health struggles. There was just no names for it, or just the research wasn't being done. And I think that brings it to where we're also having like a lot of like this generational trauma, like seeping through. And it's like
Mhm.
that's a real medical thing where it's like you have like generational trauma, which actually goes into like not only your mental health issues, but also your physical health issues, because you're carrying this weight of stress,
Mhm.
right? So, like, obviously in Canada, we have these problems with a lot of, Native communities, like Indigenous communities and everything like that. And also, obviously grateful in Canada that we have the 988. Is that what you said?
988.
8
Mhm.
hotline. I mean, I remember when there was like a kids help phone line. I
Yeah.
never called it, but, like,
Yeah.
I probably should have. But, but, like, I I mean, I just can't even think what we would do without kind of these mental health things right now, and is there something that you think there could be done better? Like, what would you think? Because 'cause you're
Mhm.
actually in this space,
Yeah.
right? So it's like, what could there be done better within Canada or even just, like, to help as a global, with the global issue?
Well, I think so with Canada, if we break it down like this, we have covered healthcare, universal healthcare.
Mm,
And so the treatments like therapy and everything is covered, of course, is free, and people can go and get help if they need it. But the problem is that really intense therapy, like treatments and treatment centers, and people who are having suicide attempts need to go to these centers to get the proper help they need to be on suicide watch. Is actually 6 months to over a year wait list. It's
Mm.
really bad, the wait list. And so by then, help may be too late.
Mhm.
mhm,
And so for that, it's not okay. And so then
Mhm.
people are relying on private mental health services like
Right.
therapy and counseling, which could be like $100 to $200
Very
um,
expensive, yeah.
to
that's
ther-
why I'm not in therapy. It's like,
They're
it's ridiculous.
expensive, but then you can go to, like, a hospital or, like, a government-funded place where there is therapy, but the wait list may be really long, or you may
Mhm,
not get the best treatment, you know? So, like, for me, I went to private a private therapist because I needed help sooner than later, and that's really expensive if you don't have your family that can provide for you, or you're a Gen Z and you don't have the money because you're figuring out your life, and what are you gonna
Mm.
do, right? So, yeah, I think for one, Canada has to create more opportunities where, maybe it's more hospitals for mental health or whatever it is, but more opportunities so the wait list isn't so long, more doctors, more therapists, so that these places where it's covered and Canadians can go and get the help they need for free can be accessible for these Canadians. And I think on a global scale, I think every country is responsible for mental health. It's really sad, but every 40 seconds, the stat says that one person actually commits suicide every 40 seconds worldwide. And so over a course of a year, it's about over 800,000 people worldwide have committed suicide. It's a lot of people. And so every country is responsible for mental health. And so I think if anyone's listening to this and you're part of a government or you're part of some way, um, you're responsible for the mental health crisis. So I think everyone worldwide needs to be talking about it and figure a way to help this and create a solution for it on a global scale, not just Canada, not just the United States, but every country, because everyone's struggling. And, the World Health Organization have put out the stat of every 40 seconds, someone commits suicide, and it's really hard. It's really sad to even think about it. It's been 40 seconds probably already, and someone in the world
Yeah.
has committed, suicide, and it's something that needs to be addressed, I believe, and people need to do better,
Yeah.
countries need to do better.
Yeah. I mean, I have a question for you, and it's sort of part of the question for me comes from a personal place. So I think that the conversation about mental health is very important. I didn't grow up in a time when anybody talked about it. But I think my one criticism about the it seems quite endless conversation about mental health, there's a lot of it all the time, is that I think for me, I am the daughter of somebody, my mother is bipolar. So I live with somebody with serious, extremely chronic mental illness that has effectively destroyed her life. And the people had a huge impact, as mental illness does, on the people around her. So I experienced this as a child, as an adult. What I'm saying is that I feel when I listen to the conversation and the narrative, as important as it is to talk about mental health and getting young people particularly to understand that managing your mind is a lifelong commitment, but that does need to be a discussion, I think, and that's why I prefaced the question by saying it's personal for me. There needs to be more of a distinction, more of an understanding between mental health, which is part of everybody's life every day. You're going to have ups and downs. You're going to be stressed. Some people deal with stress better. Some people are more depressive than others, and so on. And there are different levels, of course, and mental illness, which is something that has to be treated with medication, with care, which may never go away. And they are completely different things. And I do feel a little bit, as I said, again, this is personal before anybody comes for me, is that they get conflated. And I don't think that helps people. Like you're talking about, you were in a dark place and suicidal, thoughts and so on. That's very different from somebody being stressed. And I feel, and mental illness, and I feel that some people maybe don't take it seriously enough, or there's not of an understanding of the distinction. This is a really important issue, and we need to understand what it means to be ill, for your mind to be ill and to be suffering mental health issues like you did, and then everyday mental health management. I don't know what your thoughts about that are. And again, that's very personal to me.
Oh, that makes sense, and you have someone in your life that is affected by mental illness, so it makes total sense. I think, of course, there's a difference of people be like, "Oh my god, I can't go to work today because 'cause I'm, like, having a mental health day," of course. They're
Right.
stressed, they need to manage their
Exactly. Yeah.
stress, and they're just too much.
Mm.
And then, of course, there's a difference of mental illness, someone that, is diagnosed with, bipolar, schizophrenic, anxiety, depression. But then another thing is, like, sometimes if someone is really stressed in their life, are they stressed because they're going through a mental health breakdown, or are they stressed to the point where something could happen, or, they're so stressed, they can't pay their bills. And let's say, for example, Tom can't pay his bills and he's working 5 jobs to figure things out. And he's really stressed. And then that's the part, Risha, where he's like, okay, is Tom getting the mental health treatment or the mental health understanding of what to do? Because that situation, like for example, this Tom guy I just created, could be affected by mental illness if things keep going the way it is, because we don't know what's going on in his head or what's going on in his life. And so I think for that reason, mental health needs to be educated for everyone, because we never know when someone can get it. People can get triggered and then have a mental health illness. People can, um, have something happen in their life, lose a parent. They're going through grief and now they're having depression and then maybe potential bad thoughts. So I think, yes, of course, there's a difference with mental health management. Like, oh my God, my boyfriend broke up with me. I'm so sad. Or like, oh, my job is so stressful today. Like that girl at my work is so annoying. I'm so stressed. I want to stay home. Or there's difference with someone that maybe not have mental illness growing up, but they're stressed in their life and they need to know the right tools or resources and be educated, so that if anything, God forbid, happens where they start escalating, then they have mental illness and they have to, get the help they need.
Yeah. Okay. Yeah, I mean that makes sense. I think there needs to be more discussion, in all honesty, because I think your stories, you've pointed it out, your stories are serious. And like I said, my experience with mental illness, not my mental illness, but my mother's mental illness.
Mm.
But there are a lot of and this is a generational thing, is there are a lot of people saying, like you said, oh, I'm having a mental health day. Well, what does that mean? I mean, like, I understand that the day can be stressful, but what is the level? Where are we measuring this? And it's not helpful in many ways.
I think it's just because it's easier to take it for people. I'm not saying people do this, but it can be taken advantage of, like,
Right.
taken an advantage
That's
of
what I'm trying
by
to say.
people who are just like, well, I'm not feeling great. I want to go to
Yeah.
the beach. I'm going to take a mental health day.
Right.
Which I'm actually saying that's not that, like, that is important because we do need those days
Vitamin
too.
D. Yes. No,
But there
yeah.
is, like, there are people who are like, well, everyone cares about mental health now. Now I'm just going to have a day for myself because I'm going to pretend. And then it makes everyone else look bad who actually does need this
That's
kind
exactly
of help.
it. The people who actually need help, who
Yeah.
actually need the day to go and do something, are bunched in with everyone else who's like, just quite frankly,
I just want the day to hang.
yeah, yeah. And it's not helpful, is it? Because everyone has a stressful day. You still have to get up and go to work. I mean,
Yeah.
but I do think that bosses today, I don't know what you think, but like companies today, they are much more understanding if something happens. And I do think that's also after the pandemic, like if you have a death in the family or something awful happens or whatever it is, people actually go, oh, okay, yes, you're a human being. And I think before the pandemic or years before, it was like, well, tough. You got to come to work. You got to come to work. I do think that has progressed, and that is really important. So I don't know what your thoughts are on about that.
I think it is really important. I think, like you said, like I think the workplace, of course, and everyone around has to be involved in mental health. And
Mhm.
I think, obviously, like you said, like the pandemic happened, and it was really hard on people,
Mhm.
especially going back to work was
Mhm.
hard. But I think that everyone needs to stay involved and educated on mental health to help people out, whether it's work or friends or family. I think it's really important to be educated.
Yeah. No, I mean, I 100% agree. I mean, I think it's an ongoing thing.
Do you think there's like one specific, I mean, I'm sure there's not one specific, but like there's like 1 or 3 problems that like Gen Z is, because I feel like Gen Z is the one who's lifted this issue, which it is an issue, up, right? Like us millennials, we're just like, yeah, we're having a bad day. Our parents still made us go to school, to work, to all of these things, to soccer practice, even though we're absolutely feeling like garbage, or we are literally having a mental health crisis. They're just like, you better suck it up. And like, I know I heard that a lot when I was younger. But I think Gen Z, which is amazing,
Yeah.
which is what you guys are doing, is actually lifting this issue where it needs to be supported. But what are the maybe biggest things that I think us millennials and Gen X and like older, boomers
Oh,
even
even
are
older.
even older than you, Mel, need to kind of realize to be like, okay, well, maybe Gen Z is having a harder time because also like I'm like social media is fucked if you
Mhm.
don't mind my swearing. Like
Yeah.
it is 100% ruining my mental health, and like I didn't even like grow up with it in quotations. Like it wasn't something that I had when I was like a child. It was just a new thing when I was like 16, 17, 18,
Mhm.
and we just started this. But you guys really actually grew up with this thing of like always comparing, always like being on your phone, and like that hasn't stopped, right? So is there something else besides social media that we should be aware of?
Well, for one, I believe I grew up with Facebook when I was like, I don't know, maybe I was like 13. Like I was just getting to high school too. So
Mm.
like my childhood didn't have social media. I remember like as a kid, obviously there was no phones. I remember like my parents had like the house, like the phones, the old fashioned phones where people
Mhm.
Oh, yeah.
Oh, yeah. The rotary phones.
Yeah.
yeah. And then obviously there's the house phones, and then finally my parents had cell phones. So like I've seen definitely the generations change a lot, like from like Facebook to like or no social media to Facebook, and then like when I was in high school, that's when Instagram came out, Snapchat, now TikTok, which I don't even know how to use TikTok. I'm like not from the generation of TikTok.
That's okay. I
So,
can tell you. I know all
Yeah,
about
Mel knows all about TikTok. It's fine. Anyway.
so
I
I
digress.
think the Gen Z, of course, being that we've seen many different you know, generations or trends. We've seen a lot of things growing up. I've been I don't know, but I don't even know the age for Gen Z I'm at right now. But for me personally, I've grown up with social media, no social media and social media, so I've
Mm.
seen it change and evolving. And then the younger generations now, like the high school students, where I see through some talks, they're like next level. So I think that the generation is learning to be like advocates and be a voice in the world. And the really beautiful thing about the Gen Zs and the next generations is that we're learning what kind of world do we want to live in.
Mhm.
And so I see a lot of kids standing up for what they want, standing up for their rights. And I see a lot of, young people out there posting things they believe in. And so I think that's really beautiful. I see also a lot of young people involved in careers where they're making a stand, they're advocating for things. And so I think that's honestly so beautiful and incredible that the Gen Z can be so resilient and stand up for things. Whereas back then, you didn't see that. And so that's a beautiful thing that's happening. But of course, there are so many trends and things keep evolving and more social media apps keep happening that like it's hard to keep track. I feel
Mhm.
like I'm old right now where like I don't even know how to use TikTok. I use Instagram. I don't even have Facebook anymore. So it's like, things are evolving and changing.
They are. And I think like I have two Gen Z kids, and that you're talking about, they're younger than you. My oldest is younger than you, but they when they were sort of not quite tweens or before tweens was the sort of Instagram came about. And even for parents like, Gen X, mostly the parents of Gen Xers, knowing what to do. And I knew a lot of my friends who banned, who like, you can't look at any social media and all that sort of stuff, which I personally don't agree with, because I think the best thing you can do is give your kids the tools to deal with stuff they see that isn't perhaps what is the greatest, right? You need to give the people the tools to know how to deal with situations, because there's no way in the world today you're going to not come across social media and you're not going to come across something that you don't like. I mean, it's just going to happen. It's in your face all the time. But you need to know how to go, okay, that's just a load of bullshit, just ignore it, that's whatever, and just kind of step back from it and not kind of almost be like an avatar living in it, which I think is a bit of a problem. But I do think social media is like, it's something obviously my generation didn't have at all. It's hugely problematic. It's super stressful.
It's so stressful.
I
Yeah,
mean, you look at Instagram and all these images of continuously beautiful people with beautiful lives, and it's stressful. And
yeah,
that
it's so stressful because you get like envious of them, like, oh my god, that's a beautiful like life they're living. And it's so
right.
not real. It's filtered. It's people are showing their good sides. and their
course.
good life, but that's not really what's going on and on the end. So
It's curated. They're showing, them with their hair done and in the best
The
possible,
best
not the
parts.
crappy bits
And also,
where,
like, they probably, like, don't even like their friends, you guys. Like, they're probably
well, yeah, and the other thing about social media, and I do in the mental health thing, and I'm not at all bashing social media, but like I know a lot of people who are very like you see on social media, who you think they're actually quite lonely, and they've used social media to reach out and create a community, which I think is great. But on the other hand, it's that's not really solving the problem, is it? And maybe, yeah. But I do think there's a lot of it's difficult. There's a lot of stress there.
No, yeah, and I mean, so, like, obviously, there's a lot of people on social media who are looking for friends who are so
Mhm.
lonely, right? Like, that's a part of the problem. We honestly deal with a lot of people like this. But I mean, I think something that we would like to know from you is just like, in that time when you were struggling, when you were younger, like, is there something that if there was someone going through that same thing, they don't, they don't have the money for a therapist, right? Like, they don't have the resources that they probably need. What would be the thing that you would tell them? Like, maybe they can't go buy the books. Like, what would be the one thing to tell them, to hopefully like save their lives or just like help them to get through the dark time that they're going
Mm.
through?
I think for one, having a positive support system around you is really important. But of course, I believe of like I can't say I'm an advocate, so I can't really give advice on what to do
Mhm.
if someone's in
Sure.
a severe problem in their life to save their life right now. But I think more than anything, there are resources that are around. So definitely, call your local government. And if you're in Canada, you have a local provincial government, federal government, and you have, local hospitals and centers are around like CAMH. I would definitely go to one of those and to ask for help. If you're in high school, you ask your principal, your guidance counselor, anyone that can help you. There's always resources around you. There's always help available, so you just need to ask.
Mhm.
You need to go to these places, call these places, and ask for help. Kids Help Phone is for the youth, for young people. Of course, for me, having a positive people around me was really helpful. Journaling and doing yoga and meditating, but I can't tell people, oh, that's going to save your life
Mhm.
because, you
Course.
know, that's a big responsibility.
Yeah.
But I believe more than anything, if there's anyone struggling, really struggling, having, suicidal thoughts, to go to your local government, your local centers, your local anything and ask for the help because help is available and there is help.
Okay.
Hmm.
Yeah, I mean, and what you're doing by advocating, as you said, you're an advocate, talking, speaking, brings it more into the narrative. And then people think, oh, actually, I can identify with you. I'm not weird. I'm not alone. There's lots
Yeah,
of people out there that
Hmm.
struggle. And obviously, that's really important. It's really critical.
it's really important. And I think, that's why I like to do what I do is because if there's anyone out there listening to this today or may listen to this tomorrow, whatever it is, just know that you're not alone. And we need to normalize this. We need to have these constant conversations about mental health. And we have to do it for the rest of our lives until people understand they're not alone.
Yeah.
So, like, as someone who doesn't really have, like, let's say, like, mental health issues, I think we all have certain kind of levels of mental health issues, but maybe someone who's just less open to, you know, the fact that people do have real mental health struggles, let's say. Let's say you're talking to a boomer or anyone else who's kind of finding it hard to wrap their head around this. Um, you know, how do we get them to um really try to listen, and like what is the thing, like is it like just be patient, or is it like, do your research, or like is it just like listen to what this person's actually trying to tell you? Like, what do we tell the people who really just don't know if they, like, in quotations, believe in this kind of stuff?
Um, I think more than anything, just you have to be open to people who don't understand it, and they should be educated no matter what because people's lives are at stake. And quote unquote, if the person doesn't believe in mental health, then and you're not there for a person that's coming to you and saying, "Hey, I'm struggling," then that's that person's life on the line, and all they needed was you to just listen and to be there for them. So I think just understanding that, it's all our lives, and whether you believe it or not, to be there for someone who is going through struggles. And until you go through the struggles yourself, maybe you won't understand what it's like to quote unquote struggle so much. But I think it's really important to understand and to be there for people no matter what you believe and what you understand yourself.
Mhm.
To be there for the person if they're coming to you and saying, "Hey, I'm struggling." And of course, just staying educated and learning, listen to other people who've gone through struggles. Just have empathy to people that are going through the struggle.
Mhm.
It's removing the judgment.
Mhm.
I
Yeah.
mean, the layer of judgment, and certainly the older generations are, and I mean boomers and older than me, is there was a level of judgment, and you were judged if you couldn't basically get up, get on with it. People, and would say to you, "Get your shit together. What's wrong with you? Get on with it. Get up. What's wrong with you?" And you're like, "Well, that really obviously isn't very helpful if
Mhm.
I'm not feeling great." But I think it was just society. It was just a way. It was a coping mechanism. It was a coping mechanism for everyone, and not a very good one. And things have changed, and we're talking, and certainly what you're doing, continuously talking, continuously bringing a spotlight to this, as you said, normalizing it, making people feel it's okay, I can reach out, I can talk, that I won't be punished or I won't be judged. I think that's hugely
Mhm.
important. So, well, amazing that you're doing this.
Yeah. I
Yeah.
appreciate it. Thanks for saying that.
Yeah, because I feel like it's like even like millennials, we have this idea because we were like in that generation, which is like, get your shit together. What are you doing? Like, even like I've had that feeling of just being like, like, why don't you just, why can't you just go to work today? It's like, okay, well, no, you have to actually, you have to practice empathy just like you have to practice everything else. And I think like even myself, I've had to learn that. But like, yeah, it's just that practice of understanding. And we do have, one last lovely question for you, and it's what we ask all of our guests who we have on the pod. And I know you did go through, tough times when you were younger. So happy that you're still here with us. But we always ask, what is the one truth that you would share with your younger self if you could?
Yeah, one truth I would share with my younger self. I think it's really important to tell my younger self that she's amazing, her voice matters, and to know that she's not alone. I think my younger self would really like to hear that, and to know that she would do certain things in her life that she never thought she would accomplish.
Mm-hmm. So that's really nice.
Ah,
That's yeah. I think that's great, and that if even just that message could get out, that's amazing.
I think that is amazing. I think we have to really remind ourselves, like, to look back in our lives and be like, God, I've just come so far. And I think we don't do that enough.
Mm-hmm.
So I think it's really awesome. And I really appreciate you being so open about this
Yeah.
conversation. It obviously takes a long way to come from, what you've been through. And I think we still have a long way to go in our mental health, in the world,
Understanding.
understanding.
Yeah.
Exactly.
Yeah.
But I think you're doing so much good stuff and we really, really appreciate it. So
Well, thank you
we,
for having me on your
of course.
podcast.
No,
It's
yeah.
fun.
Can we also ask you before you go, like, so that if people do have any questions or how they can reach you? I know you do a lot of like events and speaking and stuff like that, but where can they find you, and where could they kind of connect with you or get more information about what you're doing?
Mm-hmm.
Yeah, they can find me on Instagram, social media, Britt Christantos, BRITT, and then my last name is Long, KRYSTANTOS, and they can reach out to me anytime. I also have a podcast I started recently called Dear Brittany, so anyone that wants to know cool things about me, they can submit questions, and I'll have a episode about that. And really, anyone listening to this right now, if you're going through struggles or you just want to talk to someone, just know that my door is open. I'm always open, to chat with anyone and to be there for anyone, and to know you're not alone, and that your life matters and you matter, and to reach out to help if you are going through anything.
That's wonderful.
that.
Thank you.
Thank you so
Really
much,
appreciate that.
Brittany.
And we will obviously share that on all our socials.
Yes.
So that people can reach out and understand a little bit more about you. And also, if they're going through something, it will help to see somebody strong and inspiring and help pull them hopefully from darkness to light. So that's great.
Thanks, Brittany.
Thank you so
so
much.
wonderful to meet you.
Lovely to speak to you.
Nice meeting you.
Thanks so much for listening. Please rate and review this podcast and follow us on social at Sharing My Truth Pod, and leave us a voicemail on our website at sharingmytruth.com to share your stories and experiences with us. We'll see you next time. Bye.
Bye.